move a couple windows so I can see it. Okay, terrific. Information about CMEs, if you have any questions, please get with Rana. She can answer those for you. I do not have any financial relationship or anything to disclose. I don't believe any of us do regarding our topic today. We're going to be talking about relapse prevention and specifically digging into some topics that fall under this umbrella. So I'm going to go over in more detail how to work with triggers, urge management, and behavioral contingencies. So I want to give you some specific examples of techniques or interventions that you can use that fall under the umbrella of relapse prevention. So you can pull these out and use them as needed, regardless of your role with the patient. So I want to ground this first because not everybody is familiar with what relapse prevention is. We throw that word around an awful lot, but we don't always know exactly where it fits. So it's helpful, a couple different conceptual models to kind of pin it so you can know, okay, am I doing relapse prevention at the right time with the right patient? So this is the stages of change model, and you can see it's built as a cycle. Patients don't always move through this in a linear way, but this is one of the ways of conceptualizing. So where does relapse prevention actually fit in? So we really want to start using these techniques as people are moving into action and then really hitting them home once they're in maintenance. These techniques are not going to be that helpful for people that are in pre-contemplation or even entering contemplation. We really want to be using more of a motivational interviewing, motivational enhancement approach for folks in that area, and then more solution focused when they're in planning. So we really use relapse prevention once they've entered action and are really firmly in maintenance. Another way to think about it is sort of in stair steps. You know, when people first start treatment, or maybe they've had a recent relapse and their symptoms are fairly high, what we really want to focus on is just harm reduction. We want people to be as safe as possible, as healthy as possible right now. So we're not going to be applying some of the techniques I'm going to talk about today until some safety and stability has been achieved. Once that safety and stability is there, then we can apply the relapse prevention components to help people really kind of prepare for decreasing their use and then maintaining that decrease throughout their recovery journey. So that being said, I want to go into some specific techniques today because one of the asks from this this echo was that we give you a little bit more detail to work with. So I want to spend a few minutes just talking specifically about triggers, understanding what they are, how to work with them, both thinking about the internal and the external, and then how does that lead to how people think about their use and then the behaviors that they engage in. So to really understand what triggers are and what we mean by triggers, you have to understand learning theory or classical conditioning. I think most of us are familiar with this study, and it very much applies to the work that we do when we're talking about trigger identification and trigger avoidance. So with classical conditioning, so the best example is Pavlov's dogs. So that was a study that showed that you could pair an unconditioned stimulus, so something like food, with an animal, so with a dog, and it would create a response. So when you have food around a dog, they're going to salivate. And then we can condition that response by partnering that food with a neutral stimulus like a whistle or a bell. And when we partner those things over and over and over again, what we get is now a conditioned response. And so that means that we can remove the food, the unconditioned stimulus, and just have the neutral stimulus present, and we'll still get that same response. So this happens for people during their addictive process. This is happening throughout that entire experience as they're developing a pattern of addiction. Environmental stimuli, which are neutral in nature, so going to the drugstore, which might have liquor or cigarettes behind the counter, going to the gas station, driving down a certain neighborhood, being around things like foil or cotton, lighters, even things that are neutral stimuli get partnered with the unconditioned stimulus of the drug itself. So how the drug affects the brain. And over time, just like with Pavlov's dogs, our brains develop what's called a compensatory reaction, which means that we're going to start a really intense drug craving or urge in response to that neutral environmental stimuli. So initially, before the addiction, seeing something like a lighter, we might not have had that many associations with it. Once it's been partnered with the drug enough times, then that lighter becomes as triggering as the drug itself. So when they say, one of the AA sayings is thinking about the people, places, and things that are your triggers, they're thinking about all of those hundreds of environmental stimuli that are now linked to the urges and cravings to use the drug itself. So if we don't help people really think through what all of those pairings are that produce the craving, then we're really setting them up for failure, because that stuff is in the environment. So really having a good conversation with people to identify what are those triggers or those cues for craving, and thinking through what their day-to-day life looks like to prepare for them. So it could be things like money, like paraphernalia, it could be times of day, it could even be specific emotions. One of the main triggers for craving is boredom. So thinking about, how is your day scheduled to prevent engagement with that experience of boredom, or emotional distress. Anxiety is another one that is a big trigger for people. So understanding what are the things that are paired with the drug itself. So the first thing that we want to do with trigger identification is developing a functional analysis, or what's also called identifying the drug set and setting. So you can do this informally by just going through and collecting the data on, okay, what are the details around the drug itself? So frequency, amount, how it's used, is it legally available or not? Where would you procure it? The type and quality of the substance. Are there other things connected to sort of the drug set? The individual set. So what's going on with them in terms of, where they are in their stage of change, their history of use, their history of relapse, what might be some physical pain, psychological pain that could be part of their setting, what could be, cultural or environmental stressors that we want to be aware of, and then look at the setting. How is that connected? So who do they use with, how often, what times of day, what are the environmental cues, and then the types of supports and the interpretation of that use. So when they use, or when they think about using, is there a whole nother system that comes online that's around shame or fear, or other things that make that how they interpret their use as being bad, or an example of how they're not better, or how they're not coping effectively, right? So collecting this information is really, really important. The other thing that you can do is use what's called a functional analysis, which gets at all of that information and helps us to identify what are those external and internal triggers. So this is an example of a functional analysis, and that it breaks it down. And this is something that you can absolutely use. It takes about 15-20 minutes to fill something like this out with a patient. But you just ask, okay, what are the external ones? The who, where, and when. Are you using them? What's the internal stuff? What are you thinking right before you use? What do you feel physically? What do you feel emotionally? And really trying to get at that information. And then what's the environmental cues? So who are you, what do you usually use, and how much is it, over how long of a period of time? So now we've got that drug set and setting, and we can begin to look at both the short-term and long-term positive and negative consequences. What do you get out of doing this, and what does it take away from, right? And those are really helpful conversations to have with identifying triggers. This is another version of that you can use. That's even more straightforward. So what sets me up to use? What are those triggers? And again, it really could be broken down into internal and external. And you could get really fancy with external. You could look at the drug cues themselves, environmental cues, social cues, right? So things that we could categorize by external, and then looking at the internal. So what are the things that could lead? Is it that boredom, or is it the experience of anxiety, or is it emotion of sadness? Like what are those internal triggers that could set me up to use? And then what is the linkage there between what I say to myself and what I feel? And then what do I engage in? And again, trying to get that full line all the way down to that consequence, which is the action or the behavior that's a result of allowing that trigger to drive the bus. So here's an example of that filled out, right? So you can walk through and say, so here's an example. The trigger was internal. I woke up feeling depressed. The thought that I had is, I always feel bad, right? It's never going to get any better. The emotion that I experienced was disappointment and sadness. And then the sensations, where did I feel that in my body, right? So I might have felt some tension. And then what did I do? What was the action that I engaged in? I engaged in a using behavior. And then what was the consequence? Okay, so how do I connect that? And it could be positive or negative, because we're not working on consequences when we're doing triggers. What we're working on is just helping people connect the dots in that chain of their behaviors, and helping them to understand that there is something that pushes that first domino, and that they can intervene at both ends, that they don't have to just allow that to wash over them. The next technique that I wanted to go over in a little more detail is behavioral contingencies. And so that's understanding how these, the urge to use, so I'm triggered by something, now I have an urge to use or I engage in using. How do I unravel that? How do I unpack that? And one of the first things to understand with this is recognizing that everybody has behavioral contingencies, right? So we all have something that gets us out of bed in the morning, that motivates us to keep doing that thing, to keep engaging in that behavior, whether it's something pro-social like work or going to church, or whether it's something that is less helpful like engaging in substance use. And where this comes from, again, is from a different category of learning theory. So this is based on some of the work that B.F. Skinner found, which is that people will respond to consequences, both positive and negative. So that's another reason why it's really helpful when you're doing trigger identification to have that information about consequences, because the next conversation we want to start having is helping people to identify, okay, what is actually going to be a good, strong reward for you that isn't engaging in the substance. Because we know people will respond to consequences just like animals do, and that rewards will increase a desired behavior and punishments will decrease an undesired behavior. The problem that we run into is that as a society, we tend to go for punishments. We tend to want to prioritize punishments, or at least we have historically, but they don't work as well. So remembering that the effects of reward is way more pronounced and longer lasting than the effect of any kind of negative consequence. And that makes a lot of sense with substance use, because we work with people every day who engage in behaviors that are really perplexing when you look at the negative consequences. If the negative consequences of their use, whether it's to their health or their family or their mental well-being, whatever the negative consequences, if that was enough to shape people's behavior, then none of us would have a job. So obviously those negative consequences are not sufficient. So what they're engaged in is a set of behaviors to get the positive consequence, whatever the drug use is doing for them. That's what they're focused on and engaged on. And so we have to work with them to apply contingencies so that they can shift out of that. They can replace it rather than just going without. Because we don't want people to just stop doing something. We want them to replace that behavior with at least an equal or an approximate reward. So how does that apply? Well, we can do that as providers. We can reinforce their behaviors and their engagement in treatment, their use while they're in treatment. And we can also teach them this skill using what's called an alternatives to use table. So I go back to my functional analysis, and now that I've identified, okay, the trigger is waking up depressed, and what are the positive and negative consequences? What is the outcome that I actually want? Well, that can lead to a conversation. How do I set myself up in between, right? What do you need to do in between those things so that you have the outcome that you actually want? And we need to be really careful in having these conversations, because the way drugs affect the brain, we all know, it's going to be really hard for pro-social or or like going for a walk with a friend, or having a nice cup of tea, for that to really compensate on an equal level with the way a drug is going to feel, or for that to decrease the anxiety or the PTSD symptoms, or the memories of traumas or loss that they're trying to not have. And that's one of the positives that they're getting out of ongoing use, right? So we have to really think through what is going to be the stack of behaviors that will be an alternative, and having a conversation with them about setting up their life so that they're doing as many of those alternative behaviors as possible to compensate for that one behavior of substance use. So it can be really helpful in that conversation to have a list of activities, enjoyable, pleasurable activities, because oftentimes the folks that we work with, when you're having this conversation, they can't think of things that would be rewarding, or they haven't engaged in rewarding activities for so long. You might need to encourage a level of experimentation. What could you do? What could you try different? What haven't you done in a long time? Or what haven't you done before that is worth playing with, or worth trying out? And we also want it to be culturally relevant. This is where it can be important to understand the cultural background or the environment of the patient that you're working with, because we don't want to encourage things like some of the stuff on this list, like take a bike ride. Well, they may not have a bike. Or, do something like call a friend. Well, they may not have close friends in their social relationship. So this is important that we kind of know the patient, or at least are curious about what their life looks like, and can help make recommendations that fit into their world. So with behavioral contingencies that fit within a program, there are a couple things that you can do that fall under the umbrella of contingency management. One is to do called like a fishbowl technique. So that's sort of what a lot of like dentists or doctors will do, where if you show to an appointment, you get the opportunity to pick a prize or put your name into a raffle, right? There are different ways that you could set this up so that every time they come to see you, or every time they engage in a behavior that would be helpful for them, they get rewarded in a small way. Another option would be that you create like a banking program, so that every time they engage in that behavior, they have the opportunity to earn a point that's in the service of redeeming for something larger. And that could be, again, something like a raffle, or that could be something like where you actually have a gift card or something that patients can work towards. But setting up even just engagement in the treatment itself using behavioral contingencies can be really helpful, because what we're trying to do is get people to think about building up delayed gratification and making a choice for a different type of reward over the drug use itself. And so in the last few minutes, I want to talk about the third technique, which is urge management. And this is understanding how to identify and modify those urges or thoughts before they result in that behavior. So in the functional analysis, after you've had the trigger, the next thing that we have is a thought, and most of the urges to use are thoughts. It's a psychological process, and so we can actually do something about that as human beings. So the first place to start is by logging. We have to understand what are the thoughts that are happening for the person. So they have a triggering situation, and you want them to write down, what it was. What was the urge or the craving, and put that on a scale so that we can start to measure what's worse and what's better. And then how did they work with that? Here's another example of a log to get some of that baseline data, where you're looking at, did they use, what was the urge? Was it there or not? What was the situation or the trigger related to it? And then what was the thought and the feeling that's connected to that trigger, right? So here's a blank one. Once we're clear of what those thoughts are, then we can help them do what's called urge surfing. So that starts with a little bit of psychoeducation, emphasizing that urges are triggered by external events and or internal triggers, but they're triggered. It's not something that comes up in isolation. There is something that cued that thought into awareness. It's a natural experience that's associated with any type of change, not just drug use. Trying to stop eating sugar, trying to exercise more, or lose weight, or spend more time with friends or family. Whatever change you're trying to make you're going to have urges to engage in the prior set of behavior. So that's a normal part of change. When it shows up, it's not that the person hasn't recovered or isn't doing the work. It's just that there's a need to increase coping, that a trigger is present. And so we need to do something with that trigger a little bit differently. The other important piece of information for them to understand is that these are time limited, that they will pass even if they do nothing. That's really important because I think sometimes those thoughts show up and we label them in psychology as hooking. Like you think about, like a big fish hook that comes and just snags you and rips you out of where you were. Well, those types of urges, that's exactly what they do. They hook you in and you take that bait, and it's really, really hard to get disentangled from it. So recognizing, oh, that's just an urge. I don't have to do anything with it. I don't have to change my behavior. I just have to wait. Sometimes that's the best thing. And there's a number of other things that we can recommend that are part of what's called urge surfing. So helping them understand that this is time limited and that they're going to come and go, and all they have to do is watch them rise and fall, just like the ocean waves, right? We don't have to respond to them. We don't have to do anything, and they will pass. They typically peak within 20 to 30 minutes. So helping people distract themselves, call a friend, do something within that 20 to 30 minutes can really make that a more manageable period of time to wait until the urge has passed. The other thing that's important is recognizing that they are going to come back. So it's important to practice this every time the urge is present, because when we don't do something with it, then we're more vulnerable to it. So every time the urge shows up and you don't act on it, you get better and better at being able to break that pattern, and the urge has less and less power over time. Every time we give in to the urge, and for anybody who's ever tried to diet, that you can relate to this. Every time you give into that craving, then it's much stronger the next time, right? You almost like have to hit the reset button, and that's the same thing with substances. So learning to identify and label those cravings when they're there is really, really important. So one of the exercises you can do is help people think through, okay, when an urge or a craving shows up, and that's to drink, to smoke, to use heroin, whatever it is, what can they do? So you can do a free-flowing, like, problem solve. How will you handle that urge? Or you can go over a worksheet like this, which actually gives them some concrete examples. So things to remember about urges and triggers, right? That there are certain triggers, people, places, and things that are going to cue this into awareness, that you have to do something different with it, which may include just waiting. But it doesn't mean that you go and use, and that they don't last forever. And then here are some examples of things that you could try. Let's pick one or two that you might want to try for this next week when an urge shows up, right? It could be reminding yourself that it's temporary. Get away from the situation or the trigger. Go through a list of why you decided to stop. Write that on a note card. Keep that in your wallet. Talk with somebody who'll understand and will help distract you for that 20 to 30 minutes. Say something encouraging, or have an encouraging slogan or statement written somewhere. Imagine that you're in a different place. Even imagine something about the drug itself as being nasty. So imagine a syringe filled with poison or filled with acid, right? Something that actually makes that urge much less likely. But remember that it's important to act instead of just engaging in the same behavior, which gets you the same result. So I hope that explained in a little more detail how to use these 3 different techniques and a little bit about what each of them entails. Now I'm gonna